Hello and welcome. If you're watching this, chances are you are approaching age 65 and starting to think about Medicare. This is an exciting stage of life, but it also comes with some important healthcare decisions. My name is Jill Molnar. I'm a wealth advisor and the branch operations manager at Cornerstone Financial Solutions. In this video, I'll be walking you through the basics of Medicare, what it is, when to sign up, and the choices you'll have to make about your coverage. My goal is to make Medicare less overwhelming and give you the confidence to take your next steps. So let's get started with the basics. What is Medicare? Medicare is a federal health insurance program primarily for people age 65 and older, though some qualify earlier due to disability. It's designed to help cover healthcare costs, but it doesn't cover everything, so knowing the basics helps you plan ahead. There are four parts of Medicare. Part A is hospital insurance. This covers inpatient hospital stays, skilled nursing, and some home health hospice. Usually, this is premium free if you have worked and paid Medicare taxes for at least 10 years. Part B is medical insurance. This covers doctor's visits, outpatient care, preventative services, durable medical equipment. Monthly premiums are a part of this part. The standard amount in 2025 is $174.70, although keep in mind higher income individuals may pay more. Then we have Part C, which is Medicare Advantage. Offered by private insurance companies, this combines Part A and B and usually includes Part D. It may have extras like dental and vision and hearing insurance as well. Part D is prescription drug coverage. This helps cover the cost of medications, and plans do vary by pharmacy network and costs. So now that we have covered the basic, let's talk about when to enroll. There is initial enrollment period. You're going to have a 7-month window, which is the month that you turn 65, plus 3 months before and 3 months after. Enrolling on time will help you avoid late penalties. There are also some special enrollment periods to be aware of. If you are still working and have employer coverage, you may be able to delay Part B without penalty. But once that coverage ends, you will have an 8-month window to sign up. And lastly, I mentioned before, there can be penalties if you do not follow these enrollment periods. Part B penalty is 10% for every 12 months you delay without other coverage. And Part D penalty is 1% of the national base premium per month that you go without coverage. These penalties can be for your lifetime. So not just the first year or so if you miss your period. So it's important to understand your enrollment period. Once you enroll, there are two main paths that you can take. The first is Original Medicare, Part A and B. You can also add a standalone Part B plan for prescriptions, and you're going to have an option to add a Medicare supplement, which is usually called Medigap policy, to help cover deductibles, coinsurance, and copays. Medicare Advantage is Part C. This is an all-in-one alternative. Often it has lower monthly premiums, but they will have network restrictions and cost sharing when you use services. So kind of some key decision points. Do you prefer flexibility to see any provider that accepts Medicare? Then you might want to consider the Original Medicare plus Medigap first. Or do you prefer a bundled plan with extras and potentially lower premiums? Then I would suggest looking into Medicare Advantage first. So as I conclude, here are a few items and resources that you can use and turn to. So action items for those of you that are turning 65, first is to confirm whether or not you will need to sign up, or if you're going to be automatically enrolled. This depends on your Social Security benefit status. Then you want to review your current employer coverage, if you have it, to coordinate timing. And then lastly, you'll really want to compare prescription drug needs and provider preferences to decide between original Medicare and Medicare Advantage. And take note of these resources that are available to you as well. The first is I would point you to the website, medicare.gov, for official information. There's also a state health insurance assistance program called SHIP that's available for free counseling. And obviously, here at Cornerstone Financial Solutions, we are here to help and make the process simplified. Please call us 605 357 8553 to schedule a free and no obligation appointment with a Cornerstone advisor to go over your specific situation. Medicare can feel overwhelming at first, but breaking it down into the basics, so the parts A, B, C, and D, knowing the enrollment timelines and the coverage choices makes it much more manageable. If you're approaching 65, now is the perfect time to start planning. Please don't hesitate to reach out with your questions.